Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. Yes, it is that one time, the one place that I answer your orthopedic questions, your health and wellness questions if it's not orthopedics, but most people's it is related to some sort of bone, joint, ligament, tendon, cartilage, something like that. This is meant for general information and educational purposes. Nothing I say in this is meant to be construed as medical advice. I'm not your doctor, you're not my patient. If you'd like to be my doctor, and I get about 10 people a day from all over the country, some across the world, that want to come to Charleston, South Carolina to see me. I'll talk a little bit more about that at the end, and the description where you can get more information about that is, or how you can let me know and we could contact you, is in the description below this video. Having said that, again, this is meant to, I'll stay as long as there's questions, but it is for general information and educational purposes only. Also, I say this every so often, and I think, all right, that's the last time I need to say it. Then I will see in my creator studio on YouTube, in the comments section, people that leave questions in the comments. I can't see those in the way that I send this out to YouTube, which is through Ustream. I can only see them in the chat, so leave your questions in the chat. If you're wondering why they're not getting answered in the comments, it's because I can't see them, so that would make it much easier on me. Mike, how are you? What's the consensus on anti-inflammatories if they inhibit healing, tendon healing from a tendonitis? Very good question, very insightful, because I don't think many people have thought about the effects of anti-inflammatories on healing. If you go to an urgent care, or heck, if you just sprain your ankle or twist something, the first reaction people have is to take Advil or Aleve, ibuprofen or naproxen, what are called non-steroidal anti-inflammatory medications. And the thought is they can help decrease swelling, and maybe they can, but they are anti-inflammatory. And what is important to know is that the inflammatory process is what is involved in initial healing of muscle, tendons, and ligaments, bone. Now, there are studies that show that anti-inflammatories do slow healing. Those are almost all animal studies, not human studies. The studies done in humans have not been looked, to my knowledge, have not studied a tendonitis or tendinopathy type problem. Having said that, I discourage my patients, and again, Mike, this is not medical advice, but I discourage my patients from using those if they're trying to overcome a tendonitis or tendinopathy type problem. And really, I don't like them for a variety of things. I think they're fine for just every now and then my knees flared up or whatever it is bothering me. I don't believe that they're really helpful as a long-term use for anything, whether it's arthritis or a tendon tear, ligament tear, or just an inflammation of a tendon. There is concern that in some ways they can, especially if you use them for a long period of time, can actually create more systemic inflammation by increasing the permeability of your gut lining and then creating more of a systemic inflammation, which would be counterproductive to the process. Also, you want generally some of that tendon healing from that inflammatory process. So typically, no, I'm not big on them, but again, that's not medical advice, and it's hard to personalize for any one person. Mary, good to see you again. Mary, what are your thoughts on cortisone injections to put off surgery? And if I remember, Mary, if I remember, yours is a hip arthritis issue. I may be wrong about that. Here is my thing. So one, I'm generally anti-cortisone, even though it's worse in some places than others. For a bursitis, maybe it's not such a big deal, like the bursa on the tip of your olecranon, tip of your elbow, on top of your knee, the patella, maybe not such a big deal, even though some people argue that PRP, platelet-rich plasma, would be better than cortisone. In a joint, I don't particularly like steroids, cortisone. Knee, hip, ankle, and that's because it is damaging to cartilage. Now, the thought is it's really more multiple injections may be detrimental, but I would argue that even one is potentially harmful, especially the younger you are. They're very good pain relievers. They do nothing to heal the underlying problem, but they've also been shown to, especially in a series of injections, worsen the arthritis, to make it actually accelerate the damage a little bit faster. Cortisone injections around, let's say, the shoulder joint, around the rotator cuff muscles and tendons, has been shown to weaken those tendons. So I'm not, and directly into tendons, it's definitely shown to be harmful, whether it's the patellar tendon or Achilles tendon. I'm generally not a huge fan of cortisone injections. Honestly, I feel like there's other options that are better, that are safer. There probably isn't much that is good for immediate pain relief, unfortunately, but that comes at a cost, in my opinion. And I feel like there's a lot of data out there. I do feel like it's overly used by physicians and orthopedic surgeons because it's easy and it makes people happy because they care about short term, not long term, for what that's worth. So this hit my other hand after having CMC replacement in the other hand. So there are arthritis issues. And yeah, so that's typically my thought. I know it's used a lot. Mike, thoughts on something like curcumin, cissus, or herbal anti-inflammatories? I don't have a lot of experience with cissus as an anti-inflammatory. I know if it's the one I'm thinking of, cissus quadrangularis, I know Tim Ferriss talks about that potentially from a weight loss standpoint, or curbing the damage of eating a lot of junk food on a cheat meal. As far as curcumin, I'm a big fan of curcumin. For those of you that don't know, that's the active ingredient in turmeric. Turmeric typically doesn't have that much curcumin. Turmeric, the spice, if you like sprinkle it on your food. So you would probably be better served with a curcumin supplement. I actually take one myself. Again, not medical advice, but does have very good anti-inflammatory properties. Other herbals, the other one that I think is very anti-inflammatory in terms of the interleukin-1 beta, interleukin-6, tumor necrosis factor alpha, the pro-inflammatory cytokines. The other one that I like a lot is epigallocatechin, EGCG, which is found in green tea, but it's the same issue a little bit. Green tea itself doesn't have all that much EGCG in it, so maybe that would be better as a supplement. If you do decide to do this, again, not medical advice, but just personal experience, look for one that is decaffeinated. That's just one of those ask me how I know, but I take both of those on a regular basis. Stretching, now I can't get it back on the screen, Mike. Stretching, good or bad for tendonitis? Somebody asked me that yesterday. I had a patient ask me that yesterday. There's no consensus on that. I don't follow the physical therapy literature as much as the orthopedic literature, but from all the different physical therapists I know, they all seem to have different opinions. I feel gentle stretching is okay. I feel that really aggressive, especially ballistic stretching, might be potentially harmful. That, again, you could ask 10 physical therapists, you're probably going to get a variety of different answers, and I don't know that any one of them are right. It's hard to imagine, unless it's really aggressive stretching or some sort of repetitive ballistic stretching, a bouncing type of stretching, that you would do any harm, especially a slow, static, gentle stretch, but for what that's worth. All right, Dennis, why is yours not popping up? Opioids, anti-inflammatory. No, they are typically not. Opioids have all kinds of issues. We've all heard about the opioid epidemic. I actually just had to do a CME course online about opioid prescribing, even though I don't prescribe opioids now that I'm sort of out of the performing surgery business and trying to help people avoid surgery. But you still have to do that to maintain your license in South Carolina. And I can tell you all about the opioid epidemic and all of that. I do everything I can to help people avoid needing opioids, but they work on different pain pathways than inflammation. So no, they are not typically the same thing. All right, that is all I'm seeing. All right, last thing I'm going to say before I let you go for the weekend. If you would like to come see me as a patient, we're looking for patients, knee, shoulder, hip, maybe low back pain, that want to try to get significantly better over the next 30 days without surgery, without physical therapy, without cortisone shots. We've put together protocols, treatment protocols that we've seen really, really good success with. You'd have to come to Charleston to see us, but it's a beautiful town, and literally more than a third of my patients travel in to see me, so I know a lot of people do that. If you're potentially interested, there's information in the description below. Click that link. It takes you to my contact form. Fill that out, name, email address, phone number, and touch base with me, and I and my assistant will get back to you, and we'll talk about how to potentially set that up. So keep that. It's not that close to Greenville. Well, it depends on what you mean by close. It's about 3 hours from Greenville. Greenville's on the upstate, in the upper sort of northwest part of the state. We're in the southeast part of the state, but South Carolina is not that big of a state, so it's about a 3-hour drive. Greenville's a great place, but that's we don't have an office up there. All right, that is all I've got for you this weekend. Have a wonderful, wonderful weekend. I look forward to seeing you very soon. And obviously, check out, subscribe to my channel, click the bell to be notified when I'm on live, when I release new shorts, when I release new long-form videos, both of which I do every Monday through Thursday, and most every Friday I am here for Ask Dr. Geier Live. Mike, you are very welcome. All of you, very glad to see you, and I look forward to seeing you very, very soon. Have a great weekend.